Hello, I'm Muna Al Harbi, and welcome to episode 2 of MS Talks Keep Moving Forward. In the first episode, I shared my story of MS. I spoke about how my symptoms started, my emotions, the impact it had on my family, but also how I was able to use this to transform my life. As hard as it may seem, when diagnosed, you have no option but to keep moving forward. Through this series, we aim to provide hope to other patients, their families, and friends, and spread the right information. To help us explain what exactly multiple sclerosis or MS is, I'm joined in this episode by Dr. Jihad Inshasi. Dr. Jihad Inshasi is a professor of neurology at Dubai Medical College and a consultant neurologist at Rashid Hospital, Dubai Health Authority. Welcome, Dr. Jihad.
Thank you, Mrs. Muna. It's my pleasure to be with you.
We will start simple. What is multiple sclerosis?
Okay, you want it complicated or simple?
As simple as it gets.
Simple. Okay, so multiple sclerosis is chronic inflammatory demyelinating autoimmune disease. And I'll explain each term, what does it mean in this. So first, it's a chronic disease. Second, it's inflammation in the central nervous system, which means brain, spinal cord, and optic nerve. Demyelination, as you know, the neuron is covered by a myelin, plastic cover, which is responsible for conduction of the nerve impulse, the action. So this will be lost. That's why we call it demyelination. Now, the most important point when we say immune-mediated disease. Normally, if someone gets viral infection, flu, bacteria, the immune system will form antibodies to attack these enemies, the invaders. In multiple sclerosis, the immune system will be attacking himself. So auto-antibodies will start to be formed to attack the myelin in the human being itself. That's why we call it immune-mediated autoimmune. So ultimately, it's inflammation of the optic nerve, brain, and spinal cord.
Very well explained. But what should we say the cause of MS?
Well, the etiology is a mystery because it has been extensively investigated over the last 2 or 3 decades. But I'll summarize what we came to know and what we don't know. What we know now, it is interaction between environment, infection, and genetic. So a person who is lucky and he comes with these 3 factors, he may get MS. Let's first take the genetics. Multiple sclerosis is not a hereditary disease. It will not be inherited, but the gene will be inherited. But the disease itself will not be inherited. Let's say if someone having 3 kids and he has multiple sclerosis, the kids may inherit the gene, but not the disease. They have to be under certain environmental factors, the disease to be affected. Okay, that's we have some form we call it familial form of MS. It's spread in certain families. The gene is there, but the environment which it triggered the MS to happen. Okay, so if someone tells me, shall I inherit or I'll take the MS from my father or I'll give it to my kids? No, it's not. We need other factors to intervene. So this as far as genetic is involved. The second is the viral infection. We know about certain viruses, they are definitely related to precipitating or provoking demyelination. One of them, which has been studied intensively recently, which is called Epstein virus, EB virus. And there was large study done in one of the European countries. 99% of these patients, they have antibodies to this virus. So the conclusion is viral infection contribute to the inflammation and the MS. And the third factor, which is very important factor, we know some about it. We know few facts about it and some we don't know about it, which is the environment. What is environmental factor? We are living in this environment. We are exposed to electricity, to toxin, to infections, noise. All of these are called environmental factors. The most important environmental factor contributing to MS, which we know it well, number 1 is vitamin D deficiency. Number 2 is smoking. Number 3 is obesity. Number 4, exposure to some toxic elements. When you come to vitamin D, what is the cause of vitamin D deficiency? There is some fact, if you move to the equator, خط الاستواء, they don't have much MS because they are exposed to sun and the sun X-rays will help in manufacturing vitamin D. while MS is less prevalent in the cold countries. They don't have much vitamin D. This is one of the explanations. So environmental factors include vitamin D deficiency, maybe viral infection, obesity, smoking is an important factor, it is recently identified, and so on. So environment, infection, and genetic, with the interaction, the person will be unlucky to get MS, or he may be lucky to get MS and get treatment at the same time.
If someone is worried they may have MS, what are the signs and symptoms they should look for?
Imagine now, multiple sclerosis is inflammation in certain parts of the brain, or optic nerve or spinal cord. Okay, it's inflammation. So it depends on the location of inflammation, which we call plaque, symptoms will happen. So if someone got inflammation in the optic nerve, he will get visual dysfunction, impairment of vision, blurring of vision, but not to the extent of getting blindness. Okay. If another patient gets plaque or inflammation in the motor cortex, he will get weakness, the area responsible of motor function. If sensory area in the brain is affected, patient will get sensory symptoms. If the cerebellum, which is responsible for balance, maintaining balance, is affected, inflammation happens there, patient will get imbalance and like a drunken attack, he cannot walk properly. If the inflammation happens in the spinal cord, patient will get somewhat we say myelopathy, weakness of the lower limbs. As you know, the neurons start from the brain, goes to the brainstem, spinal cord, spread to the nerves and peripheral limbs. So if we get something in the spinal cord, it will lead either to weakness of forelimbs or lower limbs. So symptoms will depend visual, motor, sensory, cerebellar, spinal, paraparesis, weakness of lower limbs, depends on the location of the inflammation.
So that will take us to the question, how is MS diagnosed?
Yeah, usually when we see someone, the common scenario, patient will come, doctor, my sister has MS and I'm worried I may have MS. Why? Because I'm getting numbness like this, tingling, visual, so I have to know the details. So number one, the entry to diagnosis, taking proper clinical history of the symptoms and presentations. Number two, clinical examination. I have to examine the patient and see if there are any abnormal signs to guide me to the diagnosis. And number three, which is very important, to do investigations. Okay. Now the investigations, this is the main thing actually, because some of the patients, they will come, they say, I have MS, someone told me I have MS, my symptoms look like MS. We do MRI, there is no MS, no lesions. But contrary to this, some patient will come to you complaining of headache. And he says, I'm afraid I have MS, I want to do MRI. So we do MRI, but he doesn't have MS, but we see lesions similar to MS. Right? So this condition, we'll talk about it later, it's called RIS, radiologically isolated syndrome. So number one is history, clinical examination. Number three, investigations. We do the routine blood test, and the revolution in diagnosis of MS is the magnetic resonance imaging, the MRI. It is a real revolution. That's why McDonald put it in the criteria, which is called McDonald criteria, which was revised 3 or 4 times. So the MRI field showed me lesions correlating to the symptoms, to the clinical scenario, then I can diagnose multiple sclerosis. If there are doubts about it, then I do lumbar puncture, getting the CSF, and there's some substance in the CSF which can confirm it's MS or not. Of course, people are scared of lumbar puncture. They make drama that it is surgery. It is simply a puncture in the spine, in this fluid, away from the spinal cord. We take fluid and analyze it, and this can confirm in certain cases if this is MS or not.
So is there anything consistent about diagnosing someone with MS, like age, lifestyle?
Yeah, generally speaking, MS happens in young females, usually, but not necessarily females. It's more in females than males. It's more in younger age. It may occur in certain parts of the world more than others. Like it's more common in Scandinavian countries, Scotland, prevalence is very high, while in the Gulf and our region it is low. Okay, so this is the age, location, lifestyle, patient having, let's say, very calm lifestyle, smokers, exposing to contaminations, toxics, they are more prone to get multiple sclerosis.
And I'm sure many people want to know, is there different types of MS? And is there different in severity of each kind of MS?
Yeah, usually we categorize MS into different ways. The first one is we say mild, moderate, and severe. Okay? Depends on many factors. How many relapses the patient got, how many lesions on the MRI, and what is the clinical presentation? Was it one clinical presentation or multiple? Like patient may come with polysymptomatology, having optic neuritis, having motor weakness, and having cerebellar signs at the same time. We say it is polyfocal. So generally speaking, there is mild, there is severe, there is moderate, right? And if it's severe, treatment has to be very aggressive. So we say highly active disease or non-active disease or benign disease. So there's many ways to categorize multiple sclerosis.
And you have many years of experience in this field. Do you think it's more common now than in the previous years?
Well, it's very difficult to answer these questions because something important. We don't have central registry in the United Arab Emirates. We have registry in Dubai in our hospital, so I can trace the increase of number of patients. We have many meetings in the past encouraging central registry to be authorized by high authority. We have many hospital registries in the countries like in Abu Dhabi, Dubai, Ras Al Khaimah, Tawam, and so on. But they are not connected to a central rule to see the prevalence and incidence. We did one study which was published some years ago. It was the first study in the United Arab Emirates. And we came to a conclusion. The prevalence was 55 per 100,000. Each 100,000 person, 55 of them, they have multiple sclerosis. And this was surprisingly high to me and to the authority who accepted to publish it, because this was the first paper. We used to think the prevalence was very low, but now we know it is not very low. It is high risk area. Later, one study was done in Abu Dhabi. The prevalence even was higher. And this is documented hospital-based study. It was 62 per 100,000. Now, to answer your question, which is very important, is it increasing or not? The general feeling that it is increasing, but we have to do follow-up studies. We have to do another study, seeing the prevalence increasing this year, every year. One of the important regions in the Gulf, in Kuwait, they have central registry. Any patient in Kuwait has to be registered centrally in one link. So they can see every month how many patients are registered. So they can trace there is increase or not. We need to do something like this. We need central registry for multiple sclerosis. It can be hospital-based in different hospitals, but should be linked to one central hub, where we can review the prevalence and incidence.
Definitely, we will need that. And my final question will be, what is the prognosis for someone who is diagnosed by MS?
With prognosis, we have a real issue. A patient coming to me now or to you, and he will tell you, Doctor, okay, you diagnosed me as having MS. What's my prognosis? What will happen to me in the future? The problem with us as doctors that MS is highly unpredictable. All right? We don't know what will happen to the patient. This will depend on multiple factors. But it is good to tell the patient that MS is not a fatal disease. It's not a cancer. It's not something very serious. It's a chronic disease, needs treatment. We respect this disease. We need to treat it, and we need to do proper long-term follow-up and monitoring. It is a potential disease which may lead to disability in some of the patients. But I'm happy to say that majority of MS patients, they have a normal life or near to normal life. We have doctors, teachers, professors in university, they have absolutely normal life, provided they adhere to treatment. Especially recently, you have very important treatment, and very strong treatment can tackle the disease and control it properly from the beginning. Okay? But we have some predictors which can tell me how to help me to predict what will happen to the patients. Number one, if it starts early age, like at the age of 15 or 16, the onset prognosis is good. If it starts with optic neuritis, it carries good prognosis. If the intervals between relapses is very far, again, it carries good prognosis. If the disability in the last 5 years is very good, patient is not progressing, this will carry a good prognosis. And depends on the MRI lesions. Patient having very large number of lesions, prognosis is poorer. And the other thing, lifestyle. We have some patients, they are heavy lesion load, they are a little bit disabled, difficult in walking, and they are heavy smokers. So I tell them, patient, my friend, I'm treating you and you are poisoning yourself. Stop the smoking at least, because smoking proved to be harmful to the MS patients. So it is a mutual treatment between me and the patient. It is a deal between me and the patient. So generally, nowadays, we have very effective treatment, and we do our best to attack the disease activity from the beginning, and the patient should have no evidence of disease activity over their lives. And again, I'm very happy many patients having normal life or near to normal life.
Many thanks to you, Dr. Jihad, for being my guest in this episode. You certainly have a big impact on MS patients in this field.
It's my pleasure to be with you and to contribute to your program. I'm sure you will be of great help to the patient understanding and education and cooperation in the future. Thank you very much.
Thank you.